Aloha, good morning. Thank you so much for being with us on this Thursday. I'm Yenji Denise, joined by Ryan Kalei Suji, and this is the COVID-19 Care Conversation, a conversation that brings you leaders and decision makers here in Hawaii on the coronavirus and the response. We are joined this morning by Lieutenant Governor Dr. Josh Green. He's going to be joining us in just a few minutes. Lots to talk about. This, of course, is brought to you by the Hawaii Executive Collaborative and Hawaii Pacific Health. And thank you all for being here and already typing in some questions.
That's right. We love to see the engagement. We love to hear from all of you tuning in. So enter your questions. We'll try to get to as many as we possibly can to talk to Lieutenant Governor Josh Green about some of the concerns in the community. We know that there's a lot of talk about inter-island travel as well as opening up the state. We'll get to hear from him and his thoughts on some of that. But of course, we like to start off our broadcast always by providing sort of an update and account. Again, one new reported case yesterday coming from Hawaii Island that will bring the total positive cases throughout this pandemic here in Hawaii to 644 positive cases. Again, that one case coming from Hawaii Island. Now, no new deaths for more than 2 weeks, and that remains at 17. So again, those numbers continuing to be in those single digits. We're seeing ones and twos and zeros. And so definitely a sign that we are definitely moving in the right direction.
Yeah, and people are clamoring to get out and to see their loved ones. Now, Mayor Kirk Caldwell calling for and getting the request granted from the governor to allow a lot of restrictions to be lifted, including people getting to gather with people outside of their households in groups of no more than 10. So we expect to see a lot of people reuniting, if you will, with friends and neighbors and loved ones that they have been missing since this all went down March 25th. It's hard to believe we have been enduring this for this long, but our work is paying off. One of those who keeps very close track of the numbers, of course, is Lieutenant Governor Dr. Josh Green. He's joining us now from the Capitol. Dr. Green, you are part of the front page news this morning saying that the inter-island quarantine should have been lifted 10 days ago. What are your thoughts about what's going on? And obviously you think that that needs to be lifted.
Yeah, it does. There's no question from a medical standpoint, it's safe to lift the inter-island quarantine or the travel restriction. We've had so few cases. I think we've had maybe 17 cases in the last 12 days, some number like that, very low. 3 new cases today, 1 case yesterday, and 3 goose eggs, the previous 3 days. So utterly little transmission here in the islands. That will become a concern, of course, and we'll talk about this, I'm sure, later about travel from the mainland here. But we have very little risk internally, and we have a lot of consequence from not being able to travel. Some of the circumstances are healthcare related, which, as you know, I'm focused on as a neighbor island physician on a weekend here or there. People can't get here for their chemotherapy. They have a loved one that they would like to travel with, but they're putting things off. They can get exemptions, they can work through the process, but the true reality is there's just so little capacity right now without inter-island travel being open that lots of businesses are unable to get up to speed. So we have consequences from the travel restriction that has to be loosened up. Gov will make some announcements, it looks like early next week, Monday or Tuesday, but I think that we are not doing necessarily ourselves a service by waiting on that. I think it was very, very smart that the Gov shut us down from travel from the mainland. That saved lives. I think it's very smart to be cautious about when we open up tourism from the mainland and Asia. But the space in between, this is the time where we need to open up, debug our system, make sure the airports are ready to handle travelers, especially because there's going to be no risk.
So what do you see as the reason for this sort of delay? What are some of the things do you think that are being worked out right now that are causing officials to really pull the trigger on making that move to open inter-island travel?
Most of it's the technical specifications of getting the process all in place. At the airport, Ford is fantastic, but having a new app, new application, new processes to bring people through the lines, to be able to get temperature checks and what have you, all of that is very new, and we've never ever done that before. So the Gov is a very process-oriented governor, which is excellent most of the time. But there are times when you got so many cooks in the kitchen and people are nervous, as you can imagine, it is scary, that it gives people pause. And every time we have pause or concern, though with no risk, it can delay progress. The things that I worry about, it's not even so much just the delay in the neighbor island reopen, but you can be pretty sure it's going to take 4 weeks after that happens before anyone's going to be comfortable opening up travel from the mainland. So one delay leads to another, and people are really struggling economically. We got through the first phase of COVID excellently because of people's sacrifice, because of the governor's strong leadership on, on the travel restrictions, on our position where we stopped cruise ships, where we got testing going. All of that worked. But now the consequences are coming from people who are losing their jobs, who are their small businesses going bankrupt and disappearing. I will not be surprised at all to see as many as 10% of our small businesses have difficulty reopening. We're waiting to get the final numbers from the chamber, but it will be significant. So those are going to have lifelong consequences for those families, for people being on insurance, all those things. So we have to open up, and we should do it right now where our prevalence of the disease is lowest.
We want to invite the audience to ask questions. Paul Lamb is asking, you've addressed the inter-island component. When do you think Hawaii will lift quarantine for international and mainland visitors? Those are probably two separate arenas. But if you're saying, I know the goal was probably June 1st for inter-island. So if that holds true, then are we looking at July possibly for mainland or doing certain countries perhaps first? How would you envision this actually moving forward?
Well, I think that is the billion-dollar question. So my expectation, and this is very fluid, is that probably about July 15th is the most likely date that we can put a tack in a calendar and expect us to be ready to have travel from the mainland and from international destinations. And I say that because you see that the Gov is being careful and cautious, like we talked about. So let's say we get a few days into June before we open up our inter-island travel, then you're looking at least at a month. And I've never seen anything come in exactly on time in Hawaii. So I think it's going to be about mid-July, which will mean that we can catch the second half of the summer from the mainland when the viral load should be low. Viruses like this, coronaviruses, tend to die out a lot in the summer months. So we'll have less risk. Of course, I'm very keen on having a protocol to have people be tested within 3 days of their travel to Hawaii, test negative, and then know that they are utterly low as a risk. But all of those things will take lots of hard decisions. But no matter what, if we have a very thoroughly layered system at the airports with temperature checks and screening and lots of databasing, and of course making sure no one traveled sick, we will probably be okay. So I think you're looking at early June for inter-island, and then mid-July, around July 15th. And anything beyond that is dangerous. I hear larger businesses talking about closing. We have to be cognizant of what that effect would be. And the effect would be catastrophic for a lot of people. And then schools are going to open and lots of other things start happening. So we're fine and safe right now with no extra viral pressure on the islands. And we should be really prepared by mid-July to screen everything out.
And what about the second half of that question when it comes to the international? Is it a tiered system, and is it country by country, or is it just international broadly?
Well, that's actually an excellent question. So the Gov has been talking with lots of leaders across the country and the world, of course, as has Senator Schatz, myself, the leadership in the House and the Senate. We do think Japan could be a very good bubble for us. Keep in mind that the viral load in Japan is likely as low as Hawaii's, very, very low. They've done a very good job suppressing the virus. They represent historically 20% of all of our travelers to Hawaii and 30% of all the revenue. Even 50% of all the people that come to Honolulu are Japanese travelers. So opening to Japan, especially because we have relationships with them and we can recommend that they do certain things like get screening done before traveling, makes it very low risk for that subset of travelers to come to Hawaii. So I like the idea of Japan. There's also New Zealand and Australia. These are large possibilities for us. So you got travel bubbles. You got first inter-island travel bubbles, very, very thorough screening for the mainland. And we cannot just throw caution to the wind. We can't just open up and hope that our lanes screen and catch everybody. We will get cases because you see that the national numbers are about 35% of all individuals that are positive for COVID are asymptomatic carriers. But there have been some clusters that are much worse. On one of the cruise ships, it was 80% of the individuals were positive asymptomatic. They had a weak strain, basically, of the virus. Can you imagine if a cohort from some city or a cruise ship came in and 80% of them were positive? They would spread it like wildfire. And we have such a low rate of infection. We have very little immunity here. So without many antibodies and with the potential for asymptomatic carriers coming into the state, honestly, I think travel with Aloha, meaning getting a test 72 hours or less before travel, will give us good protection. Is it the total answer? No, but if you did that from other countries as well, where they're very, very inclined to get tests, we could be good.
We have a question coming from within your building, Senator Gilbert Keith Algaran asking you a question about reopening without testing from either point of departure or testing upon arrival. Is the Department of Health capable of testing a reasonable sample of arriving visitors? And that's a question that we also had for Dr. Sarah Park last week. She expressed concerns about the testing before and potentially, getting tested again when they arrive in Hawaii, but Hawaii just not having the capacity to test people when they arrive here. What are your thoughts on potentially testing and setting up something locally where visitors also get tested?
Well, I think many things about this. First, let me start by saying we absolutely should test before, and I've been in conversations with CVS. I think I mentioned this a little bit to you before. CVS, and I spoke with their executives yesterday, has the capacity already up where they have 1,000 locations across the United States where they can do testing, 1,000. So we can direct people respectfully to go and grab a test before coming, 3 days before. Now, what Senator Keith Algaran says, and he's a dear friend, he states a problem we have, which is we can only do 5,000 tests per day in the state of Hawaii. Now, if we found religion on the subject, we could absolutely do it. Historically, though, our numbers of travelers are very high. In June, typically we get about 950,000 travelers. That's 30,000 a day into the state of Hawaii. Now, we could screen all of them for temperature, for fever. We can make sure we have a way to contact them, but we do not have the capacity to test 30,000 people, nor would we need to. The likelihood is a very small number, probably 1 in 1,000 individuals is going to be an asymptomatic carrier, something along that order of magnitude. They will not be symptomatic. You will not catch them with a fever, but realistically, you're not going to do 30,000 tests to catch 30 people. So what the goal is to reduce risk at all phases. So Dr. Park makes some good points, but I find it to be practically lazy for us not to at least push that possibility to get people to travel safely beforehand, because people will have the time to do it. They will also be able to demonstrate an intense commitment to the state of Hawaii. And we've already gamed out what happens if you have large numbers of travelers and they don't have screening. And within 10 weeks, if you have a surge, it overwhelms our healthcare system. Within 10 weeks, if just a small modicum of those travelers travel in and test without testing and they start spreading it without us knowing it, our hospitals will be crushed. And that will necessitate a shutdown. Also, a little bit of history lesson for everybody. If you look back at our numbers, which I do every day, as we headed from the second half of March to early April, when we got to our top numbers, we were seeing between about 22 and 35 cases per day. And what did we do? We shut it down. We shut down the whole state for 2 months. 2 months. We can't do that again. We can't afford to do that again. And that was our threshold. This is an actual experiential example of what happened in the state of Hawaii when we reached that 20 to 30 number of cases walking around. Now, when we did the governor's order, which again, I will commend Governor Ige for a very smart and strong order there, we were able to gradually ratchet it down to the point where we now have very few cases whatsoever. But it took 2 months and economic devastation and 22.3% unemployment. We can't have that. We would have bankruptcies galore. I think we probably put Hawaiian Airlines out of business if we opened up and then shut down again. I really believe that. And that would be catastrophic because we love them. So we should do all that we can, especially when the burden is on the traveler to just get a simple test. Because if we do 50%, 70%, 80% of people tested there, then it makes it easier on our system to capture and test a small number of people here.
Let's talk about what that actually looks like on the ground. So you would have a traveler, let's start with the mainland, working outside of the bubble. You have a mainland traveler, someone coming from Seattle. They get a test at Long's or CVS on the mainland. They get a test and it's good for 72 hours. They can then get on a plane. When they get here, do they get additional screening as well? Or does that test, is that enough?
They do. They still get additional screening, but they come in through a faster process. They are much lower risk. We would still check their temperature, we'd get their information, but we would not have to observe them for as long. We would not have to put them through the many hoops that other people are going to have to go through. I expect that we're going to want to have people spending 2 or 3 hours in the airport getting some assurance that they're not positive. And it's very difficult without actually testing them. We don't have enough rapid testing. It's not reliable enough to just do it at the airport, apparently. So barring a game-changing technology, we won't have that. But if someone were to get tested beforehand, think of it as a fast pass at Disneyland. They can come through much more comfortably. Then Ford and his team over at the airport will be able to quickly separate people, those that are extremely low risk, that are asymptomatic and have had a test, versus those of modest risk. That makes it easier on our team. We know that it's worked before because we've gone through this process before when we had to open up TSA after 9/11. We know that people like to go and get pre-travel clearance. It's definitely a benefit that people avail themselves of, and we don't have to pay for it. The traveler pays for it, and they do it willingly because they are committing themselves to really our ohana is what they're really doing. They may not know it, but that's what they're doing. And so we will socialize that idea with them. I certainly am doing it already. And I think it makes a lot of sense. Now, is it wasteful? No, it's not wasteful, because a small number of cases can bloom into a shutdown of the state. And sure, we might not catch a lot of cases or even save that many lives by doing the test, but what we will do is we will decrease the probability of a secondary closure almost to nothing. And that is important. Plus, it will bode very well for Hawaii for travelers. Economically, it will be a boon for us because people will then know Hawaii is truly a safe place to travel. People are all in this together. They got on the plane with the expectation that they've been tested and they were negative. It will absolutely increase positive relationships between our local community and travelers because we will know that they did something responsible that was essentially protecting our kupuna. So there's lots of reasons to do it, and there's only excuses not to do it. And it makes me quite angry when I hear the Department of Health not going the extra mile to do that, because they may be cognizant of what the actual benefit of catching a couple people is with a pretest, but to not give us a clear pathway to do it when it would decrease risk and it would send the right message globally, that's laziness. And so I don't accept that as a decision from them. If I can't get the policy passed, I will still work with lots of people to have it be practice, if not policy. If policy doesn't step up to the plate, then maybe we'll get 40 or 50% of the people doing it, because they themselves will also have the benefit, hopefully, of traveling more quickly and efficiently through our airport. And two, it will be that many fewer people that myself and the healthcare community have to worry about, a week in, that they spread it to someone that's working at our hotels or at the airport or what have you.
I want to sort of move on beyond just the visitor question. And there is a question that Shelley Elwin asked about, what are your thoughts on the legislature not using federal COVID relief monies immediately to help with Hawaii residents and economy? We know that the legislature decided to put some of that money away in the rainy day fund for next year. What are your thoughts on the legislature's process and the way they handled this past legislative session?
Well, I think let me actually give some credit to extra credit to my legislative colleagues we had 14 years together, and so I appreciate them. what I think is they're coming back in June, and I think that it was so fluid for the legislature in the month of April, early May, with surging unemployment and just unbelievable changes to the structure of our economy, that parking the money temporarily, because that money has to be spent. I think I know they're completely aware that the CARES Act money has to be spent in a timely fashion. I think this makes them more responsive to what we actually see happens once we see unemployment settle, once we see the economy begin to reopen. So I don't think that they've missed any opportunity. I think that they're just being careful, number one, about saving enough money as we see where the real suffering is, and two, they're going to be back again in I think little more than 2 weeks. So I think you're probably going to see a lot of expenditures from that special session in mid-June. As to immediate need, though, wherever we see social service need, I would like us to aggressively fund it, because we're seeing spikes in depression, we're seeing spikes in access to services for the homeless community, we're seeing spikes in domestic violence. None of those services should be allowed to go away. So any department that's working on those things deserves to have resource, and I do actually expect that the legislature will continue to have that priority. So
Janet,
they're going to have another bite at this apple here in a couple of weeks. I don't think that they're going to. I think they're probably going to be coming back every 6 weeks or so, if I had to venture a guess, all the way through the fall, because we're going to see one sector struggle, and then they're going to settle down. Then we're going to see another section of the economy struggle, and then they'll settle down. The one additional caveat I would make, forgive me, is I would like to see, if it's possible, some extra resources go to small mom and pop businesses right now. There was not a natural mechanism for them to get resources easily. A lot of them have difficulty getting the PPP loans, those loans that can be repaid if people come back to work. A lot of them didn't have the infrastructure to go for them, and I really don't want to see those guys go out of business. That would change, in some ways, really the fabric of Hawaii. So that may be something that has to be looked at really significantly in June.
Janet Honda has a question, and I think it's an apt one. She's asking, how do locals test coming home from Vegas? Through our own physicians here when we get back, or do they have to quarantine? Everyone does not have 14 days to take off every time we travel. We know that a large majority of the cases that were experienced here in Hawaii were from residents, returning residents, who were then infected and infected their friends and family. So the tourist piece is one piece, but we have a lot of people who have rock fever right now. They've been trapped inside for 2 months and they want to get to Vegas. Vegas is opening up June 4th, I believe, as the casinos will open up. So a lot of people want to go to the 9th Island. How do they come back? How do you envision that working?
Well, I don't believe there will be a quarantine after we really open for return, which is the date, mid-July. I think then you will have this robust process at the airports where you will be able to be screened, and then you'll be back into society. But it is a risk. And Vegas, more than any place, I think necessitates a quick test before they come. Now, you're not going to catch everyone, but if you're sitting near somebody for hour after hour and they've been drinking and they lean over to you because they just won $75 and kiss you on the mouth, you could catch COVID. And we saw cases of that. And so I really think it's dangerous for us not to have a serious policy for certain hotspots to get tested beforehand. Again, it won't be perfect. People are going to have to be very aware that they're putting themselves at risk. There are certain areas across the country that have had big spikes: New York, Jersey, Massachusetts, Nevada. And I would caution people not to go there unless they are prepared for a very rigorous reentry testing process. You will, though, like I mentioned before, be able to, if you are worried about it, be able to go simply and get a test. You could do it here when you get back, of course, but you'll be able to get it across the country before you know it.
Another question we wanted to ask is sort of the quarantine police that are sort of happening here. We're seeing it in the state. We're seeing a lot of local residents reporting visitors that are violating the quarantine, but we're also seeing how some local residents are being sort of racially profiled. Some news in the past few days of local residents who may look like they are actually tourists are being targeted by locals. Are you at all worried about this disconnect that's happening within our own fabric in our society, where locals are very, protective of the island, and they want to see that it's safe. And sometimes they're taking it out on people that are actually residents, but telling them and reporting them when actually they are locals themselves.
I am worried. Look, people thought I looked like a tourist until I started flipping that stupid whiteboard, right? I mean, and had 1 billion followers. So it is it's worrisome, right? And there is bias. The truth is, we can mitigate that concern by having a good policy where we simply get people a test, so anybody coming in is not a risk. We saw a really serious bias against individuals in Chinatown in the early phases of COVID-19, because Wuhan had been the epicenter of coronavirus before that. And so there was a lot of animosity towards people who are Chinese who own businesses in town. There was this suggestion that relatives had been visiting from China, and therefore there was a lot of virus. None of it was true, okay? You did not have some big surge in the middle of Chinatown. So that is a real problem. And that's yet another reason why I'm saying having a standard where we can all know, no matter whether we're white or black or brown, or whether we look Asian or Hapa, all of us, if we have the same standard when we travel back from Vegas, or we travel back from New York, or we travel in from Japan, there should not be any concern that we've had extra risk, or that we've got extra exposure to the disease. And it's yet another example of the benefit of having really comprehensive screening and probably testing. It's just something that is not often discussed or considered thoroughly enough, because the Department of Health works in one silo, which is a very critical silo. They did a great job making sure that we didn't have explosive outbreaks in different parts of the state, but it's not their place to make other decisions that blend into some of these cultural questions. And so I would hope that we would all see that as a reason to really be careful about how we travel. And we've come a long way over the last decades of treating people with respect and not having any kind of we've pushed away from racism pretty well here over the last 5 decades, right? Obviously, before any of us were born, but it was an enormous problem in the wake of World War II and Vietnam, all of these challenges while we were near Southeast Asia. That has pretty much gone away. And we really do have an extraordinary melting pot. That could switch real fast if you get a nasty outbreak from one country. So I would not take the risk at all. And I think we also have to be very direct in our communication with our people and say, we're all truly in this together. That's why what I do for my public health and my family also affects you, and what you do affects me. And so because we all took precautions like we have these last 2 months, we did a good thing for all races.
I want to get to one question from Christine Donnelly. She writes the Kokua Line column for the paper. And she says, nearly 66,000 unemployment claims filed as early as March have yet to be processed. What's the state's plan to get those claims processed? Hawaii people have been waiting more than 2 months for their claims to even be processed. Scott Murakami has been joining us every Tuesday for the last, 5-6 weeks, and they are chiseling away at this massive number. But he started his department with 7 employees. Last check, he said he had about 300 people helping him between the state library and the convention center. But a lot of those 66,000 that Christine is talking about have to be adjusted, with an actual person. It's going to take them a long time to get through all those numbers. So what's the state doing in that regard?
Well, that was pretty extraordinary. I think I want to give Scott and the Gov a lot of credit here. To bump that up to 300 people is special. And what they have been able to do, and I'm not making any excuses for government, they've been able to process hundreds of thousands of actual claims. These remaining 66,000 claims, as I understand it, and I could be corrected here, they've had some fundamental flaws in their application. And look, I'm the first to admit I would mess that up if I had to put in unemployment claims. I'd get my numbers wrong. I probably would use some code incorrectly or something. I just don't love that kind of paperwork, okay? But when you do those applications, if there's any problem, like for instance, you don't have the right account number, or you put a an account and you suggested it was a savings account versus a checking account. There's lots of different problems that arose. There was also the question of people, this is not from that 60,000 much, but there was fraud. So they're having to catch any problems very carefully, because we've even been reading about that from other countries and so on. So we've been trying to call people back, and a lot of times people are not answering their phones. Maybe they don't recognize the number. Scott's team is working extremely hard to, one by one, get everybody their unemployment monies. And so almost all of those applications, is my understanding, almost all of those had pretty significant problems with them. And so when there are errors that are filed, and again, I'd say I probably would have made the same errors myself, it makes it harder because it can't just be quickly processed. My cousin, for instance, ended up unemployed, and she got her unemployment benefits in just 2 or 3 weeks. She just was very, very careful to do it perfectly. She's a school teacher, had been a school teacher before she was unemployed. And so there are reasons that people aren't getting them now. But everyone, please do your best to be patient, and please do, if you get a call from any of those 300 individuals, take the time to go with a fine-tooth comb over your application to get it perfect, because we want you to get those resources.
Well, Lieutenant Governor Josh Green, we thank you for spending this time with us and really covering a lot of topics here. And I know our viewers really appreciate their ability to ask you questions directly. So we thank you again for making time to join us here on the COVID Conversation.
May I have one last second?
Yes,
Please,
go ahead.
yes.
So some special things. I want to thank the Hawaii Operation Mask folks. We organized a group, and they gave 752,000 masks to the healthcare community in Hawaii. We're dropping off 60,000 in Maui today. Amazing. And then the Aloha Free Clinic, we're calling it, it's just a care for people who are in between healthcare. If you go to alohafreeclinic@gmail.com, write us an email and we can help refill medications or do a quick visit for free. It's going to be in Kalihi starting on June 1st. That's Jim Ireland and lots of good volunteers. We have over 150 medical personnel that are volunteering there. So we hope to give free care for 3 months in case you're somewhere between your job and didn't get qualified for Medicaid. So those are things that people are stepping up, and we're so honored to see happen in Hawaii. We're going to be okay, guys, but just, got to get through a couple more months.
Thank you so much. Thank you so much for being here, and thank you for all the hard work that you're doing for our community, especially that clinic. I know is going to be so important for so many who, as you said, may not have medical benefits because they've lost their jobs. So thank you for that.
You bet.
All right. Aloha.
Well, interesting to hear again that, you hear this disconnect between what's happening at the Capitol and also the Department of Health. And it sounds like they're butting heads on this issue of testing. There's still a lot to be worked out. It does sound like we're going to have inter-island travel back early June. And then he was saying July 15th could be when those travel restrictions are lifted for everyone else.
Yeah, and again, really pushing for that pre-testing that happens for visitors that are coming into the state. So before anyone enters the state, he's really pushing for making sure that people are tested, because he recognizes the state doesn't have the capacity to, as he said, test 30,000 people. Of course, that was when Hawaii was at its peak with the visitor arrivals, but the state just doesn't have the capacity to do that. So using that as the first layer of screening, and then using temperature checks and other means for when people do arrive, and almost, as he called it, sort of that fast pass system that Disneyland sort of incorporates, maybe doing something like that here. Also talked about those travel bubbles, potentially opening up with Japan first. And we've also heard the governor mention that as well with some of the countries that he has been working with and talking directly to. So, there is a lot of dynamics that has to be involved here. And he recognizes that there are a lot of things that need to be put in place, but he certainly wants to see that happen sooner rather than later.
Yeah, we always appreciate his transparency and all, how he's sharing all of these ideas. It's interesting, this idea, like you said, of the fast pass. I know that in today's paper, there's an article just about that, how CVS here in the islands known as Long's Drugs is going to start offering self-swab testing. That's beginning tomorrow. So you'll be able at 2 of their stores to do drive-through swab testing. Again, that's just so the public has more access to testing. So, CVS is one of the largest pharmacy companies in the country. And if they've been talking with the governor or with the lieutenant governor, as he said, if they could create some kind of a system where you get a test, 72 hours later you get on a plane, and then you don't have to be subject to a quarantine. There was a comment in here I saw just a second ago, Candace K saying, I hope you release a video of this so we can share it. You can share it anytime. You can share it while we're live, but as soon as we're done, you can also share it, and you can go back and watch key parts if you want any clarification on what the Lieutenant Governor had to say.
That's right. And again, we know that this is a pretty significant week with some things, especially here on the island of Oahu, opening up, including some of these barber shops. And we are seeing how some of these, retailers are making adjustments to make sure that they can adhere to some of the requirements that were required for the new reopening. So, we're looking at some of these photos of how salons have made the adjustments to allow for these touchless hand sanitizer dispensers, as well as ways in which they have had to adjust to meet the needs. So this is going to be interesting to see how various barbershops and salons sort of implement this sort of social distance upon something that requires a pretty close personal contact.
Yeah, it's very interesting to see how they'll make that adjustment. And, one of the things with salons, and we know that this, compared to so many things that people are facing, is low on the list. But one of the things that's nice about seeing your barber or your stylist is that you have, you talk to each other, and you kind of have this the camaraderie, if you will. I know that I always end up telling the person who cuts my hair my life story and what's going on in my life. And so, how the stylists are able to maintain those relationships, and how they're actually able to physically cut hair if you have your mask on. It's a work in progress. I know a lot of salons are not taking walk-ins, and they want everybody to make reservations so that they can space folks out. That's definitely one industry that we expect to have a big boom as soon as it opens this week. So that'll be interesting to see. I expect to see a lot of haircut selfies on Instagram.
Yeah, I could definitely. It's time. It's time.
He mentioned the Hawaii Hero. Sorry, go ahead.
Yeah, that's definitely. We want to talk about the Hawaii Hero, who the Lieutenant Governor actually briefly mentioned in his closing statements.
Yeah, Hawaii is welcoming a massive shipment of surgical masks, as he said, 752,000 to be exact. The shipment is half of the $1 million order that's paid entirely through donations in a project spearheaded by Kauai resident and Saltwater CEO Ryan Graves. It's amazing to see this. They're going to be distributed to hospitals, clinics, first responders all across the state. That is done, of course, in partnership with the Lieutenant Governor. Ryan Graves has generously connected donors and his time with a reliable manufacturer in China, and then used his contacts to have those shipped to Hawaii. It's all made possible from Mr. Graves, along with Kamehameha Schools, the Hawaii Community Foundation, the Atherton Family Foundation, and Hawaii Pacific Health, again, with the help of the Lieutenant Governor. So we love to see that. Thank you so much for those people, individuals, and different organizations for stepping up and providing this needed resource.
That's right. So again, we like to salute them, our Hawaii Hero. And again, we always say, if you have a Hawaii Hero that you would like to spotlight and highlight, please let us know in the comments. We do go back and read these comments to sort of address and figure out what sort of guests you want to hear from next. That's another thing. If there's someone out there in the community that you would like to connect with, that you would like us to bring on the show, please let us know. And we'd be happy to reach out to some of those leaders. We have another leader coming in tomorrow. Speaker Scott Saiki from the House of Representatives will be here to talk a little bit about the state's effort. We heard the Lieutenant Governor address this, but we want to know specifically about some of those decisions that were made to put some of the federal CARES Act dollars back into the rainy day fund. We know that they have been a lot of vocal opponents to that plan. We want to hear more about their thoughts moving forward and how the state will sort of adjust to this $1 billion shortfall in the state budget, including cuts to some critical departments. And so we want to get an insight into some of the decisions that were made, as well as what they're looking forward to when they resume session in a few weeks back in June. Again, that's Speaker Scott Saiki happening tomorrow. We encourage you to come on back and tune in, or enter your questions now, and we can save them and make sure we ask him that tomorrow. We also have Governor David Ige returning to the conversation on Monday, as well as our Tuesday regular, Scott Murakami from the Department of Labor and Industrial Relations.
Yeah, and we also want to remind you that tomorrow is the food bank distribution at Aloha Stadium. Starts at 10 o'clock. You can start lining up at 7 in the morning. It's 50 pounds of fruits, vegetables, meat, eggs, milk, enough to feed a large family. So we really appreciate, the community partners that have stepped up, along with the Hawaii Food Bank and the Hawaii Community Foundation, Bank of Hawaii and others who are just making this amazing thing happen twice a week. So if you need more information, you can go to hawaiifoodbank.org. They also have 200 other distribution sites throughout the state. They don't necessarily do food giveaways of that size at all 200, but if you aren't near the stadium or you can't, stand in line for that long, there are other ways to get food. So please do reach out to that organization. They've been doing so much for our community. And if you need help right now, if you need food, please don't hesitate to reach out and get it.
That's why we're very thankful to them. And again, thankful to all of you for tuning in here today and for sending your comments. We apologize we couldn't get to a lot, but Lieutenant Governor likes to talk. So we try to get as many questions as we can, but he has a lot to explain and we certainly appreciate his candor and his comments. So we thank you for tuning in. We thank again our sponsors, the Hawaii Executive Collaborative, as well as Hawaii Pacific Health, for helping us to engage in the community through this conversation. And for more information, you can always, of course, head over to the HonoluluStarAdvertiser.com. Until tomorrow at 10:30, we will say aloha.
See you then.